activist with Rise and Resist and Gays Against Guns, J.W.
Good evening, everyone. I'm J.W. Walker. I use he, him, his pronouns, and I'm going to start with a quick question for everyone here tonight. Is everybody here ready to do everything within their power to make the state of New York the blue state that it is supposed to be? Are you ready to make that blue wave sweep over Albany? For the past year or so, I have been so impressed by the extraordinary work that the No IDC Coalition, which includes many of my friends from Rise and Resist, has been doing. Yeah, give Rise and Resist a little bit. What they have been doing to educate New Yorkers about these wolves in the sheep's fold. Thanks to their work, the IDC has gone from a shadowy coterie barely mentioned in news stories about the dysfunction in Albany to an almost universally recognized source of that dysfunction. The pressure put onto the current governor and these fraudulent senators actually prompted them to state publicly that they were dissolving the IDC, that the IDC would cease to exist. Liar! So why are we here? Because they lied. This isn't the first time they tried that little gambit. The people of New York bought it the last time, but as the saying goes, fool me once, shame on you, fool me twice, shame on me. And the No IDC Coalition has been ensuring that New Yorkers unaware of the IDC's past tactics won't get fooled again. So I'm here to talk about healthcare. I've been in New York for 33 years. For 21 of those years, I've been HIV positive. I was fortunate enough to have a job that provided me healthcare shortly after I tested positive, and I did well for about a decade at that job. When I left that job, though, I had COBRA for about 6 months, and then I lost my health insurance. Having a pre-existing condition, I wasn't eligible to get any other health insurance. The job I took as an independent contractor paid me too much to go into any public plan, but didn't pay me enough consistently through the year to allow me to even buy into the ACA once that was made law. I had to become destitute in order to save my life. Every day, 5 New Yorkers die due to lack of healthcare coverage. 20,000 New Yorkers have died because of the lack of health coverage in the last 10 years. Over 1 million New Yorkers lack health coverage, and millions more would be bankrupted should they be faced with a medical emergency. The fees charged by insurers have risen over 50% in the last 5 years throughout the state. Each year, 1/3 of patients without insurance go without needed prescriptions. In there. The richest 1% of Americans have an average lifespan that is 15 years longer than the lifespan of the average American, of the average poor American. Healthcare is a human right. I want all of you to repeat that with me right now. Healthcare is a human right. One more time, one more time. Healthcare is a human right. Thank you. And not just healthcare in the abstract, affordable, comprehensive, patient and provider-directed healthcare are what every human being deserves. Our choices regarding our sexual health, our reproductive health, our preventative health care, our general health care should not be subject to the caprices of elected officials, insurance company executives, or call centers based halfway around the world. Decisions about our health care belong between ourselves and our medical care providers, period. The current system is choosing profits over people. The New York Health Act would provide comprehensive, universal health care to every New Yorker, regardless of age, employment, or financial means. The New York Health Act has passed the Assembly every year since it was introduced and has never come to the floor of the Senate for a vote because of the GOP and the IDC's control over what comes to the floor of the Senate. Please help us change that. Please help turn the state Senate, and therefore all of the New York State Capitol, the brightest, boldest, Miranda Priestley endorsed cerulean blue,